Hello again, this is Dr. J from LifeSpine Health Enhancement Center. This video talks about a common condition I see in my clinic on a weekly basis, and that's not back pain or neck pain, but knee pain. And many chiropractors are very highly trained on every other joint in the body outside of those of the spine. And in addition to my doctorate in chiropractic, I also have a master's in sports science and rehabilitation. Now, those studies have given me a broader, detailed understanding of every joint in the body, particularly those of the ankle, the knee, the hip, and also the shoulder, the elbow, and the wrist. And so I can take my knowledge that I learned working with athletic individuals and apply those to the general population. Because let's face it, we all suffer injuries of the same joints, but whatever injures them are oftentimes the uncommon denominators. And conditions like carpal tunnel syndrome or golfer's elbow, tennis elbow, frozen shoulder, rotator cuff tears, hip impingement syndromes, knee degeneration, knee sprains, ankle problems, all of these conditions everyone can suffer from, whether you're participating in athletic sport or if you're not. And that's the reason why a lot of patients seek out care from my office, is because our familiarity with these types of conditions and our success of treating these common conditions. But although they're common, they certainly are not normal. And so we do urge people that if they are experiencing abnormal symptoms, whether it's just an acheness, a stiff, or a pain in any of these joints, or if it's more serious, if it involves numbness or tingling into the fingers or feet, that they do seek out care, and a chiropractor may be a suitable option for you. But this video also wants to touch about knee pain, because knee pain, there is no good reason for a knee to hurt unless you have a direct blow to that knee from like a sporting accident or a history of, let's say, jumping out of airplanes, which I certainly have patients who fall into that category. But for the majority of people, they're experiencing knee pain for other reasons that are outside of the knee. And to address the knee directly, maybe through injections or drugs or physical therapy to the knee specifically, that may not be the right approach for the majority of individuals. And I'm just going to give you one example. And hopefully I'll have an image here that pops up to explain this. But it goes to show how the joints above and below the knee can have an effect on it and can slowly lead to pain and eventually degeneration of that joint. And if the joint becomes too far degenerated, it might require reconstructive surgery or perhaps a total knee replacement, which, ask anyone who's had one, they are not fun procedures and should be avoided. But the cause should be identified. Now, the image here shows how a simple overpronation of a foot, or having a foot that rolls inward or perhaps is flatter than the other, causes a chain of events that works its way up through the body and affects every single one of those joints. And as the foot rolls inward, it causes the shin bones to rotate inward as well, which puts in stress upon the joints of the knee and can wear away the cartilage and the meniscus and strain the ligaments that support the knee. Also, that change is affected further upward in the kinetic chain of events, and you can see how the pelvis drops to that low side, causing a pelvic imbalance or an unlevel foundation for the rest of the body. This can lead to abnormal spinal curvatures that affect all the way up into the shoulders and neck. So as you can see here, a simple problem in the foot and ankle leads to a chain of events that can lead to not just knee pain, but also pain in many other joints of the body. And this is just one example. There can also be problems in the hip in terms of restriction in a range of motion that can also put stress upon the knee. It's crucial for people that have knee pain to really look beyond just simple pain management and find the underlying cause of the problem. And a thorough evaluation by a qualified practitioner, whether it be an orthopedist, a physical therapist, or in our circumstances, a chiropractor who's trained in extremity conditions, that a thorough examination is used to identify the true underlying cause of that particular painful joint, whether it be the knee, the ankle, the hip, the spine, whatever it is. So here in our office, every new patient, one, receives a digital foot scan that's going to evaluate the true foundation of your body, which is your feet. And it can rule in or rule out the possibility of having overpronation or ankle problems that could contribute to your knee pain or back pain or what have you. Also, if x-rays are indicated, we do have digital x-rays that we take in our office, and they can identify any underlying structural problems that could be contributing to your particular condition. Beyond that point, before we do any treatments, everything is explained to you in terms of the findings of your examination and x-rays and what is your true underlying cause. Then we work towards finding a solution to those problems and letting you know what we can do for you at that point in time. So if you'd like to learn more about specific knee injuries and how to rest in an acute injury setting, follow the links provided, because on our website at lifespinecenter.com, this week's blog article talks about common acute knee injuries and how to care for them prior to perhaps seeking out care from a qualified professional. Also, if you like what you heard in this video, please subscribe to our YouTube channel. We do give updated information on a weekly basis on a wide variety of different health topics. And perhaps it's something that can give you the further information you need to find the care that you deserve. For those of you watching in the St. Louis area, here at LifeSpine Health Enhancement Center, we're located in Swansea, Illinois, and we give care to all the surrounding communities: Belleville, Fairview Heights, Shiloh, O'Fallon, and all of the neighboring outlying communities as well. So if you have any questions, concerns about any ache or pain that you might be experiencing, please call our clinic. Our number is 618-622-9770. We'll be happy to do what we can do for you and see if we can find a solution to your problem. In the meantime, I'd like to thank you again for watching, and in the meantime, stay healthy. This is Dr. J from LifeSpine Health Enhancement Center.